The Philips Innospire Essence Nebulizer Compressor System offers reliable aerosol therapy in a system designed for intermittent use. With Philips' highly efficient SideStream Nebulizer to provide a fast treatment in as little as 6 minutes. This video shows the different steps to using the Philips Innospire Essence Nebulizer Compressor, including setting up the SideStream Nebulizer, preparing the medication, taking a treatment, cleaning and maintenance of the product, checking and replacing the filter, as well as storage between uses. It's important to carefully read the instructions for use before you use your Philips Innospire Essence Nebulizer Compressor for the first time. The proven Philips SideStream Nebulizer works by pushing compressed air through the tubing into the medication chamber. SideStream is designed to boost airflow via an active Venturi system, resulting in fast drug delivery and short treatment times. It also has a unique diamond jet design which helps to minimise wear from frequent use and aids consistent delivery of a high-quality aerosol. The respirable output of the SideStream is increased by more than 140% compared to a traditional nebulizer. SideStream will provide consistent drug delivery time after time, making a Philips SideStream nebulizer an ideal choice for aerosol drug delivery you can trust. Place your Philips Innospire Essence Nebulizer Compressor on a firm, flat surface near an electrical outlet in an area where you can be seated comfortably during your treatment. Check that the filter is not clogged, dirty or wet, and replace if necessary. Operating the unit with a dirty filter can impair proper operation and cause damage that's not covered by the warranty. Plug the power cord into the electrical outlet. Assemble the SideStream nebulizer cup and air tubing together as shown. Attach the other end of the tubing to the air outlet on the compressor. Both ends of the tubing are the same. When you're ready to add the medication, unscrew the top of the SideStream nebulizer cup and pour in the prescribed medication. The SideStream nebulizer cup is suitable for 2 ml to 10 ml doses. Screw the top back onto the nebulizer cup and attach either the nebulizer mouthpiece or the face mask. Don't lay the SideStream down on its side because the medication will spill out. You can use the parking post on your device for securing the SideStream when not in use. To take the treatment, sit in an upright position, relax and switch on the unit. Make sure mist is visibly coming from the mouthpiece or mask. If using a mask, place securely in position over your nose and mouth and breathe slowly in and out through your mouth. Or, if using the mouthpiece, take it between your teeth, surround it with your lips and breathe in and out slowly through your mouth. When the SideStream begins to work intermittently and sputters, the treatment is finished. There is no need to nebulize every drop of your medication. There will always be a small amount left in the medicine cup. When your treatment is complete, turn the power switch off and unplug the device from the electrical outlet. Always unplug the unit before cleaning. The device can be cleaned by wiping down the outside of the compressor with a clean, damp cloth. Do this at least once a month. After cleaning, make sure the unit is working properly by checking that air still comes out of the nozzle when the unit is turned to the on position. Disconnect the SideStream from the tubing. Unscrew the top from the medicine cup. Rinse out the nebulizer and refill with clean water. Reassemble the top and medicine cup, reconnect the tubing, and run the SideStream again for a few seconds to flush out any drug trapped in the nebulizer jets. Disconnect tubing from the medicine cup and wash all items, apart from the tubing, in hot soapy water. Rinse all parts in clean water for 2 minutes. Shake off excess water and allow to air dry. Do not towel dry. Reassemble and store the SideStream in a clean place when not in use. The Philips Innospire Essence comes with a dark blue SideStream nebulizer. This means it is disposable and should not be boiled. It's recommended that you replace your SideStream according to your instructions for use. The filter should be checked regularly and replaced when it becomes discoloured or dirty, clogged or wet. To change the filter, remove the white filter cap by gently pulling it out. When replacing the filter, make sure it's fully inserted. Don't wash or reuse the filter, and don't use the unit without one.